Hello, my name is Stephanie Diana Ramon Lemos, and this is my presentation Lupus Project, a technical English form. And Stephanie Diana Ramon Lemos, Heidi Marlene Batz, Brian Emanuel Zapeta y Boris Nofio. For what is lupus? And lupus is form of an immunity and disease in which the immune system cannot disease between foreign and particular antigens. And its own cells or tissue and both inserted produce and antibiotics against itself. And this is an B-body in art gadget in autonomy are associated with disease. And probably an every of the assigned topic and its significance in lupus management. A laboratory test example in samples of blood, urine, or body tissue at technical or doctor and analysis the sample the determine if the result with normal limits and this uses a range in different values and because what is considered normal varied from person to person many factors and affect the results. And this is my presentation. Thank you.
My name is Heidi Batz. Psychosocial aspects and quality of life consideration for lupus patients. Some people with lupus have mild but not safe changes in behavior such as failing of fear or look of fear and loss of interesting and curiosity. More commonly, the fatigue and pain of lupus are exhausting to the point that a person changes their outlook on life. If a person with problems with lupus and their brain ever be okay. Eh, whether the problem with lupus is moderate or severe, there are supreme and effective ways to address problems with things and memory and behavioral issues. Counseling and interpersonal medication can help many people. Support groups are a good place to learn ideas about how to focus better, remember important things, know that other life what differ and know of lupus can also make the experience of having lupus feel less l- lonely. Education strategies for the patient with lupus. Maintain a manageable schedule with moments of rest, raising also responsibility of need, ask, ask friend or family to help chore when possible. Children talk to them about lupus and know it is can affect life at home.
Hi, my name is Marilyn Sanchez. Treatment option and management strategies for lupus. Objectives of treatment plan: prevent or treat disease outbreaks, prevent or reduce organ and joint damage, reduce inflammation and pain, support the immune system, balance hormones, and anti-inflammatory drugs. They relieve arthritis pain and might suppress autoimmune symptoms such as muscle aches and some pleuritis or pericarditis. Corticosteroids, they remain the most important medication for controlling many of the symptoms that occurs in lupus. Virtually all complications of this disease are amenable to substance treatment with corticosteroids. Anti-malarians, these drugs are used in lupus for treatment of arthritis, some skin lesion, and for pleural and pericardial symptoms. Uh, Immune suppressant, they most commonly used are azopril and cyclophosphamide. These drugs used only there are important complications of disease and especially in the kidney. Thank you.
Hi, my name is Brian. 4. Patient education and self-management strategy for individual living with lupus. Um, One of the recommendations for patients with lupus and to maniacs take care status will be to stay away from snooning, rest in order to reduce fatigue, the use of prescribed medical therapy, prevention and control on infections that could guide patients carry out vaccination, carry out designate diet with low salt, fat and cholesterol, liquids, the reduction of stress levels, avoid consuming anticonceptives, and be able to reduce um, psychosocial effects. The management of this disease is to know the recommendations one on therapies, emphasizing health education with aim of promoting changes in lifestyles to prevent the appearance of complications associated with the disease.
Hi, my name is Boris. I'm going to talk about a case study about lupus. It's going about a 36 years old female patient. She attends a medical consultation. She presents a headache that the intensity is 8 over 10. This is accompanied by facial pain, palpitation, adenopagus, and epigastric pain of intensity 6 over 10. She also has a high pressure, a high heart rate, and high respiratory rate. Only the oxygen saturation and temperature was okay. She also presents a soft and cold light edema and edema in the upper extremities. After a proper questionnating and through physical examination, as well as the use of laboratory tests like immunological test, she was diagnosed with a systemic lupus erythematosus. So she's going to take a treatment that it was consisted of immunosuppressants. And to finish this video about systemic lupus erythematosus, we're going to talk about two questions. A challenge encountered during the research process. We believe that one of the challenge was coordination and finding information that was relevant and true. And the other one is most interesting or surprising findings. We think that the most interesting finding is that the lupus has no cure. There's only medication, and the doctor suggests a better lifestyle. Thanks.